I'm into practice since long, but my patients don't want to sign a consent form. They are very reluctant at times. They feel it is an additional paperwork. Do you also face such a problem? Hi, I'm Dr. Bhavdev Ahuja. I'm a dentist with 23 plus years of experience, and along with dentistry, I'm training and coaching colleagues on the topics of practice management, medical legal ethics, consent, documentation, and finance in dentistry. So, in a recent survey that we did in our WhatsApp community that I'm running since 5.5 years now, uh, one of the participants put up this query that my patients don't sign the consent form, although I want to, but they are reluctant. And this is from a doctor who is sitting in a tier 1 city. And let me just break it down for you. What exactly is a consent form? The first thing is it is not a consent form. Yes, you might be shocked on hearing this. It is known as a customized informed consent form. Now, why do I put those words? Because it actually stands for this. Number one, the consent forms are not at all same for all specialties. They are different for different specialties, which means a blanket consent form like I hereby absolve my doctor of all the wrongdoings. I hereby give my permission to my doctor for all the work that they do in my mouth. I hereby allow my doctor to do all the work in my mouth. All these are blanket consent forms, absolutely invalid in any court of law. Now, this is regarding the consent form, why it is related to different specialties, different regardingly. So a journalized consent form, if we talk of, is not needed at all, which means you don't need a informed consent for a written consent form, for a checkup, for an X-ray, or for basic things. But you do need it for many procedures, especially depending upon the kind of procedure you're going to do and the kind of patient mindset it is. Now, I mentioned the words customized informed. Now, as I said, the forms are different for different specialties. Another thing that holds good is that same patient for the same procedure will not have a same consent form. Why? Because your consultation might be different with that patient. The mindset of your patient would be different. So whatever you have, and maybe that patient's expectations are different. Maybe that patient's outcome may be different. Maybe that patient's prognosis may be different. Maybe that patient's post-op plan after that procedure may be different. I'm just comparing two RCT patients, and maybe one of them comes with a missing tooth along with. Maybe one of them has a poor oral hygiene along with. Maybe one of them has an isolated situation of a root canal. Maybe one of those cases has multiple root canals. So no two patients can be same. No two cases can be same. It may be purely entirely luck that you may come across similar cases. So that means if the forms are not same for all specialties, they are not same for all patients also, which means it is a customized informed consent form. Now, I've deliberated on the word customized. Let me just break it down further for you. The question is that we come across consent forms. Google anything, for example, periodontics consent form, endodontics consent form. You'll open up a huge list of consent forms. And you will also find so many of on the IDA head office website as well. What I call most of those forms as the body of the consent form, which means the middle part of the consent form. For middle part, you can Google anything specifically, you'll find it. But the consent form is not about the body. It is about the head and neck and the tail end or the toe end or the limbs part also, if we talk of human body as such. So you have the body already, which you can Google. But the top and the bottom needs to be customized as per the patient, which means the top will include the patient consultation inclusions, whatever you have talked out with the patient, whatever the findings were, what is the prognosis, what are the RBOs, what are the risks, benefits, and options. Sometimes a patient would, the tooth may be savable, but the patient says, nikal do, remove this tooth. Now you will take a consent form for extraction, but where does that communication come into? That the patient could have a easily salvageable or savable tooth, but the patient decided against it and wanted to extract it. Nowhere. You have no evidence, no, you can say, testimony in your favor, which will absolve you if the patient tries to go the legal way later on. So consent can be your best defense. Now, this is about the top, which mentions about, I call that as the PCIs, or the patient consultation inclusions in that. Now, regarding the payment part, regarding your policy and procedure part, let's take an example of an endodontics consent form. You open up a case, open up a root canal, I mean, and the patient disappears for 2 months. Comes back after 2 months with a pain, with a lot of pain, with swelling, and complains, doc, I'm really sorry, I could not come. I had a family emergency. My wife fell ill. My father was not well. I got a fracture, whatever reason, medical reason. You empathize and you do the dressing, do the needful, do a little bit of preparation. Of course, the gap is there. You may not be able to immediately obturate it or restore it. So you clean it up and do the dressing and recall the patient after 3 to 4 days or a week, depending upon the case. Now the patient again disappears after 2 months, disappears for 2 months, and say, doc, I because of my lack of absence in the past 2 months, I just got too busy in the operations of life. I was very busy in my work. I didn't have any problem, but I was too busy in my work, so I could not come. Now he's come because he again has pain and swelling. Now you do another thing and then he again disappears. Now in all this while, the patient has paid you only once. And I'm supposing that you have charged prepaid. If you were to charge more than what you have initially promised, where does that fit in? That fits in your consent form. The total charges for the root canal are this, without the restoration, without the crown. Now, this is another point of contention. Doctor, आपने तो बोला था filling and crown बीच में ही होगा. You said that post-obturate and the crown would be in the same cost. You have to delineate those things, mention it. This is valid for the treatment lasting for a period of 1 month, 2 months, 3 months, whatever it is. Of course, it doesn't last beyond 15 to 30 days. That is the max limit, even in high infection cases, usually. So usually, as I said, so you should be assured of that if the patient does not return back after 2 months, 3 months, he needs to pay up for that. And that goes in the terms and conditions or the policy and procedures of your clinic in that consent form, because you are not getting any other document signed. Now, this is the customized consent form. Still left with explaining the word informed. Now, when the patient comes to you, you talk about it. You detail everything to the patient. What happens after that? The patient builds a rapport. The patient has certain questions. You handle those questions, answer them as per their satisfaction. You detail all the, you can say, all the options available for that particular set of treatment or for that particular set of problem that the patient has encountered. For example, a missing tooth may be, of course, the implant is the first option, then maybe followed by a bridge, then maybe followed by a cast partial, maybe followed by Maryland, maybe followed by flexible, whatever options. Why are you choosing that option? What maybe for that patient, implant may not be the best option given the condition. Maybe crown bridge is the first option. So you need to put that across to the patient. Now, once you have resolved all the doubts, discussed all the RBOs, risks, benefit, and options with the patient, you just have to explain at the end. Whatever we have discussed, we'll put it on a piece of paper so that you also get the security that yes, all your doubts have been answered as per satisfaction, and we are ready to move ahead as per our pre-decided course. Now, the bottom line fundamental behind a customized informed consent form is that you and the patient are on the same page as before the start of the treatment. And once you guys are on the same page, consent documentation signing becomes a procedural formality. The problem comes when we pitch it wrong. The patient comes, we detail about root canal, and we throw a form in front of the patient. Ye document sign kar do bhai. Just like Shashi Kapoor did in Diwar movie with Amitabh Bachchan. And the patient is saying, मैं क्यों sign करूं? तुम sign करोगे कि नहीं? भाई तुम sign करोगे कि नहीं? And we go on in that Diwar mode. We have to make them understand the importance of the treatment. Because we are in a hurry to start the treatment, because we want to not let the patient go and think about it, we want them to make an impulsive decision, we make them start. Just to be on the safer side, we throw a form at them. And when we throw the form at them, that is not customized as well. That is the blanket consent or the body of the consent that you're pulling out from your drawer or from your worksheet, and you are making the patient sign. So proper consent form needs to have the patient consideration inclusions, your terms and conditions, your payment protocol, and of course, the body of the consent. And after adding all this, the consent form should not take more than 10 to 15 minutes to make. Number one. After adding all this, consent form will never cross 2 A4 size pages. That is the beauty. People say the consent form becomes tad long, too much long. Patients won't want to read it, don't want to sign it because you have paged it in a wrong way. Just make them understand. Never be in a hurry to start the treatment. Be on the same page. Explain them. Talk to them. Discuss the RBOs. Discuss all the options. Discuss all the side effects. Discuss all the pitfalls. And then when the doubts have been answered to their utmost satisfaction, and this happens in a medium to big ticket case, we all detail so many options. The payment protocols have been discussed. Everything is smooth. We'll put everything of this on black and white or on black and blue or on the paper. And that's it. And that is how consent after a verbal talk, informed. Consent believes it is not a piece of paper. Hospitals mein jaise hota hai na, most of the hospitals sign kar do. It's not that. In a clinic, in a dental clinic, the word informed consent means you verbally talk out, detail out, so that inform is just document or consent form is just a procedural formality. So I hope I have been able to address the query from you and from many others. Those who believe, please send me your consent form. There is nothing called as a fixed consent form. Every consent form is customized. We have the templates. We have the bodies. Bodies you can find everywhere in Google, but we have the templates, which I teach in my customized informed consent workshop, which I take up once every 6 months. So it is usually done in March and September. So if you want to learn that consent form making, it is actually a proper science. So learn about it if you want. So the second part of query which I wanted to address from this doctor was, since graduation to until recently, I have been practicing in tier 1 city in private clinic and a medical center. Then we shifted to a close suburb of that tier 1 city. Of course, I'm not naming that city part for the reason of anonymity. But it was always my dream to set up my private practice, but kept on delaying due to different reasons. This January, I achieved my goal and set up my clinic in the suburb of the tier 1 city. Until April, the patient flow was slow and steady, but May turned out very bad. I'm trying to implement different marketing ideas every month, and I know it takes time for a new practice to pick up, but this is definitely a major concern right now. Number one thing is, I want you to feel that it is absolutely normal. The second thing, you need to be a little bit patient about it. You enjoyed 4 months, 4 good months, and you had 1 bad month, and suddenly you are depressed. You are trying out marketing strategies, perfectly all right. I mentioned about the marketing strategy in in 2 of my previous Wednesday videos. You can find the same on the YouTube channel. So do search into that channel and find the recent videos on 7th of June and 14th of June. They will answer a lot of queries from you. Do go and network outside your zone, reach out to people, drop that word EGO, which I discussed in my previous video, equal to God only complex that we all have. So once you have that, implement your marketing strategies, give it a little bit of long road. Once you are networking well, once you are visible enough to your target group, once you have a little bit of patience, and once you give a reasonably long rope to your marketing ideas and strategies, trust me, everything will sooner or later fall into place. Thank you so much for watching this video. If you like this, please do share with friends and colleagues. And I request you to please subscribe to my YouTube channel as I come up with one of my long form content videos every Wednesday. And the kind of pain point queries that we have received, probably I may decide in near future to come twice a week to answer all those queries as well. So I hope this time spent in this video was well worth it. And if you found any value, please continue to visit my channel and watch all the old videos which are there on the channel. So I hope you all have a great day and a great weekend. Bye-bye. Take care. God bless.